Hi, I'm Oliver Khoo. I've been an orthopaedic surgeon with St Vincent since 2011. If you're considering a knee replacement, it can feel overwhelming and there is a lot to understand before you make a decision. So, to help you get started on your journey, here are the answers to the most common questions patients ask me. Knee replacements are excellent these days. They should last over 20 years. These are the two different components. And this actual implant that I use has a special ceramicized metal coating on it, which is really important because it makes the surface as friction-free as possible. So when the surfaces are rubbing, so that's showing you what it would look like if a knee is moving, it means that the actual friction which occurs at the surfaces is as low as possible, so it wears as low as possible. The reason why that knee replacements need to be revised isn't specifically if the plastic wears out. The two commonest would be if someone is walking along, falls over and has a fracture around the implant. It can actually loosen the implant, and that would mean that the knee replacement needs to be replaced. And infection as well. So if the implant got infected and it loosened the implants at the interface with the bone, that again would have it being loose and painful and would need to be replaced. Recovery from a knee replacement starts straight away. On the first day when you have had a knee replacement, it's the best day probably for 3 months. You'll have the most movement, you'll be able to move it and go, thanks doc, that was really good. And your pain is usually extremely well controlled and you'll have a big bright smile on your face. And then the next day you'll probably want to try to kill me. And it's good because if you can catch me, you can, but it's actually something where your movement becomes worse the next day before it gets better. So it's always darkest before the dawn, and that's why working on your physiotherapy is really, really important. So the best predictor of how much movement someone gets after a knee replacement is actually how much movement they have before. So the stiffer your knee is before the knee replacement, then your gains after surgery will be less than someone who has a full range of movement to start with. What we hope for is that people have movement of around 130 degrees of bend and that their knee is out straight. There's pain associated with all surgery, and it's more about how do we actually keep you comfortable or control the pain. So we use the gold standard way of delivering an anaesthetic to make sure that pain is controlled from the very beginning and giving you the best chance of making sure that you won't have pain after surgery. It's a mix of a spinal anaesthetic or a nerve block, which means local anaesthetic to numb the legs, and then a general anaesthetic on top of that. The general anaesthetic is then less in the amount that's needed to be given, which means there's less risks of vomiting, nausea and things associated with a general anaesthetic, and it achieves the same goal of keeping you comfortable and letting the surgery be performed. After surgery, as soon as you start feeling pain, when the local anaesthetic starts wearing off, we encourage you to have medications from the nurses so that as those oral tablets are starting to have an effect, they get to the level of where they're effective when the spinal anaesthetic is wearing off. It depends. Do you have somewhere to be afterwards? You can either have a knee replacement or watch a game of football. It takes about 90 minutes to 2 hours. Those are the questions I've heard most from my patients that I've helped move past pain and restore their quality of life. If you'd like to discuss your specific situation or have any more questions, feel free to reach out. My team and I are here to help guide you through every stage of this journey.